Hello and welcome to our presentation entitled Using QAPI to Reduce Readmissions. My name is Brandon and I'll be your operator for today. At this time, all participants are in a listen-only mode. Later, we will conduct a question and answer session during which you can dial *1 if you have a question. I will now turn it over to Holly Standhardt. Holly, you may begin.
Thank you, Brandon. Again, my name is Holly Standhardt, and I am a Quality Program Manager for MPRO, who represents Lake Superior Quality Innovation Network. And I want to thank everybody for attending today's event. And I wanted to just give a quick background. Lake Superior Quinn is comprised of 3 organizations: MPRO in Michigan, Medistar in Wisconsin, and Stratus Health in Minnesota. And we support the Centers for Medicare and Medicaid Services priorities for healthcare quality improvement in each organization's respective state. Today's webinar slides will be available on our Lake Superior Quinn YouTube page within the next couple of weeks. I would like to introduce you to today's speaker. Ann Banister is a registered nurse and is a clinical quality consultant and works on CMS Services antipsychotic medication reduction tasks. She has worked as a staff development, clinical educator, and infection preventionist in the skilled nursing setting. Julie has participated in QAPI processes, served as an EHR trainer, and was selected as the Surgical Services Lean Project Manager while working as a nurse circulator. I would like to turn it over to Julie.
Thank you, Holly. Hello, everyone. Happy Friday. So thanks for taking time with us today. We're going to seek to understand how using QAPI, or the Quality Assurance Performance Improvement Process, can help to reduce hospital readmission rates for your nursing home. Our objectives today, we're going to describe the 5 key elements of qualified QAPI elements to your facility's rehospitalization reduction program. Even the Office of the Inspector General believes that QAPI is the best approach to reducing adverse events and related hospitalizations. The Watchdog Agency made this clear in its February 2014 report entitled Adverse Events in Skilled Nursing Facilities. As over half of the adverse events identified in the 2014 study were deemed preventable, the OIG stated that substantial reduction of readmissions must occur and gave its blessing to the CMS-led QAPI program development and issuance. So there's good news for skilled nursing operators facing the daunting task of reducing readmissions. We have alignment between policy and providing good clinical care to skilled nursing residents, and there are powerful software tools that can give providers a distinct advantage, and we're going to cover many of those today. So we're excited about being able to provide those tools. One of the tools that we have available is the National Nursing Home Quality Care Collaborative Change Package. That's a mouthful, but it's actually a really comprehensive package that provides us guidance in our striving to achieve QAPI success. The package actually is providing us with strategies and care bundles that we can use in order to move our QAPI forward. The strategy that we're going to be using to guide today is Strategy 6. We're using that to reduce readmissions and emphasize the 6D change concept. So Strategy 6 involves providing exceptional, compassionate clinical care that treats the whole person. You're going to find a continuing thread of teamwork, interdisciplinary work that we're going to be talking about today. The change concept that goes with Strategy 6 is transition with care between shifts, departments, and all care settings. So that really reinforces that teamwork. One of the reasons that we want to look at that strategy is we need to ensure that the team who is engaging in our QAPI process knows the residents well and can anticipate their needs, can effectively manage the residents' changing health conditions to avoid those healthcare-acquired conditions. This package, as I said, is comprehensive. We're also going to see elements of Strategy 1, which is leading with a sense of purpose, Strategy 2, where we're recruiting and retaining quality staff, and Strategy 7, constructing solid business practices that support our purpose. All of those apply here. So the change package includes what's called a change bundle. The change bundle is a structured way of improving the processes of care for the resident and improving their outcomes. It's a small, straightforward set of evidence-based practices, when performed collectively and reliably, has proven to improve outcomes. This is taken again from that change package item that is available to you through the QAPI website. With the development of QAPI and introduction of QAPI regulation, nursing homes have incentive to focus on the QAPI development of systems that prevent adverse events and promote the quality of care and quality of life. So this change bundle actually is going to place our feet on the path to success. So building a successful QAPI program, we need to define what QAPI is. Many of you are already steeped in the processes, but this is a really exciting way to look at QAPI in a more in-depth, from a more in-depth perspective. QAPI is a systematic, comprehensive, data-driven, proactive approach to performance management and improvement. QAPI involves the coordinated application of two aspects of quality management systems: quality assurance, the QA, and performance improvement. Quality assurance tends to be more reactive. We think about quality assurance when we're responding to a citation or we need to respond to an adverse event to correct a problem. The PI, the performance improvement, is continually working on improving systems and processes. It's being proactive. So in the PI, the performance improvement aspect, all staff are taking ownership in identifying areas to improve and how to improve them. This is very empowering to our staff, and they become very invested when they know they are part of the process. An effective QAPI plan creates a self-sustaining approach to improving safety and quality while involving all nursing home caregivers in practical and creative problem solving. CMS has identified 5 strategic elements that are basic building blocks to effective QAPI. The 5 elements are your strategic framework for developing, implementing, and sustaining QAPI, and they include design and scope. The first one is the key design element, and you're including patient and family engagement, cross-continuum team collaboration, health and information exchange, and shared care plans. The second item is governance and leadership. Are we reducing readmissions, and is this a strategic priority of the entire team led by the head of the organization? What resources will be available to support the improvement? So if we don't have leadership buy-in saying we want to change these processes, then we're not going to get buy-in from the entire team. And how are we going to be able to support that when we have residents on the floor that we need to care for in our normal scope of work, and how are we going to be able to sustain that once we get those projects underway? The third item is the feedback data systems and monitoring. These are systems in place to monitor care and services. We're going to be drawing data from multiple sources and using those performance indicators to monitor a wide range of care processes and outcomes. We're going to review findings against the benchmarks and the targets that the facility has established. So we're going to be talking about how to set those measurements up. And then we're going to track, investigate, and monitor adverse events. So while we're improving our processes, we're also continuing the care that we've been providing all along and actually identifying those processes that are part of quality improvement. And then the performance improvement projects, the PIPs, and if I say PIP, it's because that was a common terminology for me, but the PIPs are a concentrated effort on a particular problem in one area of the facility or facility-wide, and they involve gathering information systematically and intervening for improvement. So let's focus now on how to start the performance improvement project charter. Okay. All right. So I'm sorry, I actually jumped ahead. I apologize. We're going to look at our systematic analysis and systemic action, which is the 5th element of QAPI. Sorry about that. With the systematic analysis and systemic action, We require thorough and highly organized, structured approach to determine whether and how identified problems may be caused or exacerbated, and then we will use a root cause analysis to understand those. The new long-term care regulations emphasize using QAPI principles and processes to improve the safety and quality of care and life for residents. So this session will provide another example of how using the QAPI principles can help your team take action. Now we're looking at the QAPI 12 action steps, so QAPI at a glance. These action steps are helpful to getting your QAPI process underway. They will help you on the road to implementing QAPI, and you needn't engage in these steps in order. They do work in conjunction with each other, so you may find those steps happening simultaneously. Get familiar with these steps. They are available for you on the slides to ensure that you have that successful implementation. Again, that leadership, responsibility, and accountability. We are developing a deliberate approach to teamwork, so we're not shooting all in all different directions. We are working on a specific goal or specific goals. We're going to self-assess. How are we in our current QAPI process, and what can we improve? And then we're going to use the QAPI concepts within our organization's guiding principles. So are we staying true to our mission and vision? We're going to, in the process, develop our QAPI plan, conduct a QAPI awareness campaign. Again, this is a multidisciplinary effort, and we want everyone in our facility, including our residents and our family members, to understand that we are working to improve their care, and we want everyone to be on board with that. We'll develop a strategy for collecting and using QAPI data, so we're collecting meaningful data, something that is relevant to our goals. We will identify our gaps and opportunities where we can improve and prioritize opportunities and then charter the performance improvement project. So we're actually in the process very likely to gather information that is relevant to improving a process, but not necessarily associated with readmission, hospital readmissions. So we may actually want to table that information that we gather and use that data at a later date to improve that process that becomes evident during our improvement. We will plan, conduct, and document our PIPs, get to the root of the problem, and then change the systems that aren't working effectively for us. So what do? We have a high rehospitalization rate. We know it's there. We know it's a problem. We need to address the problems, and it requires focus, structure, and a systems approach that is data-driven. We are using QAPI as our framework. So for QAPI and rehospitalization, we have 3 steps to take. The first step is for the facility QAPI committee to identify increased trends in residents being rehospitalized within 30 days of admission. This information can be obtained from various sources, including MDS data, feedback from referring hospital partners, Lake Superior QIN quarterly readmission reports, and we invite you at Lake Superior QIN to use us as a resource. We are able to provide you with much data that can inform your process. That's actually why we exist, and we love it. We can provide information, or we can receive information from our corporate readmission reports, and of course our certification and survey provider enhanced reports, the CASPER confidential feedback report. This is your nursing home's official rehospitalization data, so that's internal data. With step 2, when our research reveals rehospitalization rates that have increased above the national benchmark, our facility needs to identify what readmissions were preventable and unnecessary. And we're looking at this hospital readmission process through the eyes of our residents, because they are the population that is impacted, and that's why we're improving quality. And step 3, we're involving pulling together the performance improvement project team to include the DON, the ADON, the administrator, admissions director, social worker, medical director, CNAs, and any support staff deemed necessary. Again, there's that interdisciplinary approach for a comprehensive look at our processes. Thanks, Holly. So So let's start with a review of the Institute for Healthcare's model for improvement. So the QAPI committee will follow this model in order to improve processes. We have 3 questions, again, that should be used in conjunction with the model for improvement. The first question is, what are we trying to accomplish? This question ensures that the team has a specific outcome they're trying to reach. So we're staying focused on our goal by asking what we are trying to accomplish. The second question asks how we know that the change is an improvement. This question allows our team to identify measures that will be used along the way to track their progress and ensure they're moving in the right direction. The measurement, once identified, do we want it to increase or decrease? And we need to know that. And then, of course, the third question asks, what changes can we make that will result in that improvement? This is where the teams identify the key changes and interventions that they will actually test to reach the goal. The Plan, Do, Study, Act cycle, or PDSA, is shorthand for testing a change in the real-world setting by planning it, trying it, observing the results, and then acting on what's learned. Our model of improvement asks us, what do we want to accomplish? We want to examine our status and know what our rehospitalization rate is. So we're going to look at the data, and again, we've talked about the different sources for the data. We're going to compare the data. How do we relate to state and national rates? And what a readmission rate is the goal of your referring hospital system. So we want to use all of those resources, to identify and inform what we're working toward. Your rates could be national, state, or local. And ultimately we want to determine what is your nursing home's current readmission rate. So the next slide is actually a document that provides some information on how to understand the CASPER report and interpret the feedback. And this is available for you to take care in that process. If you have any questions, again, we'd be happy to answer those for you. So let's examine our current processes for any red flags in the admission process. So we're going to look at admitting, our current processes that are involved in day-to-day care, and then what happens for our residents at discharge. The pre-admission is one area where we can be proactive in ensuring that we are not causing a situation that could have been prevented. Are there potential admissions to our facility that we are not equipped for? For example, do we have residents who have IVs, trachs, peritoneal dialysis? Is our staff trained and equipped to deal with any of those conditions? Those are things that we need to think about at admission. Are there any omissions of information that are red flags to us when we are getting the hospital discharge report? Are they giving complete information? Is there anything that we might be missing that could cause a concern for the residents down the road? And are we admitting high acuity residents without planning ahead? For example, a resident with a trach should have supplies in the room prior to their arrival. Do we require isolation precautions? Are any concerns prior to getting that resident in our home? And we want to look toward the actual process when the resident is in our facility. On this slide, I'm sorry, do we have that? There we go. Okay, thanks. On this slide on the right-hand side, the question asks, should I reference the Interact program to help me address these questions? Interact is a series of tools that provides guidance on how to care for your residents while they are in the facility and treat them appropriately when there are any changes of condition. These are communication tools, and the entire Interact system is designed for clear and concise information and communication interchange amongst the entire interdisciplinary team. So should I reference the Interact program? Absolutely. This is a really valuable program. Those tools are set up to prevent any concerns that might happen for your resident. And we want to control the things that we can control. So when things do come up that we can't, we can get to the root of the problem much quicker. In the discharge planning process, are we starting the discharge process upon admission? Everyone's input is important for the care of the whole person. We need that whole picture of the resident. And when we have the interdisciplinary team coming together, we may understand fully how the resident is impacted by rehab, by their medications. Maybe the physician has some input about how they're wanting the resident to be cared for after discharge. So we want that full picture of the resident. Are we properly discharging residents with clear and concise instructions? It's very easy to give residents information, think they understand it, but if we're not providing teach back, or we're not experiencing seeing a success with that resident before they leave, then we're not ensuring that they really understand their instructions for discharge. And is social services completing a post-discharge follow-up to ensure that resident's well-being? We want to check on that resident after they've left our facility to ensure they're having successes with their care. Okay. So we're going to examine our current processes by doing a readmission self-assessment using probing questions. Using this Safely Reduce Readmissions Probing Questions document, you're going to be examining your processes to determine the strength and weakness of your system. This handout is available for you in our the documents that we're going to make available. And we're going through this process to determine what are the problems or areas needing improvement. If your nursing home's readmission rates are higher than others in the state, why? We want to understand that. So when we want to understand why certain situations are occurring, we're going to use the 5 Whys tool to conduct a root cause analysis. So with the root cause analysis, the 5 Whys, we're going to write down a specific problem. Writing that issue helps you formalize the problem and describe it completely. It also helps focus the team on that same problem. If you're asking the why problem, why it happens, you're going to follow up with why is the other supporting information occurring. And this is a breakdown of the system. Most often this is used in skilled nursing facilities to understand the problem. We're not going to focus a great deal on the 5 Whys, but do know that this information is available to you as well. So what we'd like to provide for you is actually a tool to take back to your facilities and start to understand your quality improvement processes. We're providing the case study and change of condition process evaluation tool. On the left is the worksheet that you'll be using in your nursing home to understand your processes of communication. And on the right, we've been actually given a wonderful document it's called the Change of Condition Communication Process document. And we're using this with permission from the Colonial Acres Healthcare Center in Golden Valley, Minnesota. I'd like to give them absolute praise for taking time to really understand their communication processes at the beginning of the change of condition for a resident to prevent that readmission. So this is great that they gave us this tool to provide to you as a guidance, as a teaching tool. You may have discovered in your 5 Whys that there is a breakdown in communication of vital information to key members of your IDT. One of the tools Lake Superior QIN has created, again, is that case study and change of condition tool. This tool is going to give you the case study to break down exactly what your process is, your process of communication, to what is being communicated, to whom, and what the result is if there is a breakdown in that system. Thank you. Okay. This is another form of root cause analysis, and what I like about this breakdown is you actually are being provided with some suggestions for why you have a readmission rate that might be higher than the national average. So we're looking at the reasons why. Why is this resident going back to the hospital? Is it harder to care for the higher acuity resident? Do we have at-risk patients not properly identified at hospital discharge? Is there a lack of the disease-specific protocols? Do we have those care paths in place when we're addressing a specific concern? Is there lack of communication between the hospital and the nursing home? And are there no current processes in place for pre-admission assessment of the resident's clinical status and needs? So those are some of the suggestions, and you can use this information to empower you as you work through your that tool that we sent back with you. Okay, so what do we want to do with the holes in our processes? What are we trying to accomplish? Again, we've talked about establishing our goal. We want to craft a goal statement to guide our work. Goal statements communicate what a team hopes to accomplish and the magnitude of the change. Goal statements have 4 parts: what the team expects to do, the goal completion date, the intended population, and the measurable goal to be achieved. If you're having trouble getting started with your goal, the QAPI goal setting worksheet is a useful tool that will help guide that process. And again, this is available for you. So we're going to write our goal statement based on the SMART elements of goal development. Those components are specific, measurable, attainable, relevant, and timely. And the SMART goal that we use should be descriptive, yet concise enough that it's easily communicated and remembered. And again, use that goal worksheet to frame your goal setting. We're in the measurable area, when we talk about the measure we will use, this is the measure of hospital readmissions within that 30-day period. And we want to measure that, we want to identify that measure again against the national benchmark. What is our current data figure, and what do we want to do? Increase or decrease that number? So we will find our baseline and then move toward that, improving that. Is this measure attainable? What measurement are we trying to achieve? What actions are we going to take to reach that goal? And we want to check that our goals are challenging but realistic and something we have control over. We don't want to set our facility up for failure. We want to make this a workable goal because it's going to be something that we want to sustain, so it needs to be something that we can actually get our arms around. We're going to establish a goal that is relevant and time-bound. Reducing hospitalizations is the goal. We want to focus on the processes that affect readmission. Have a time frame for goal accomplishment to encourage completion of the work, and then free your team up to move into the next improvement phase. Okay. So we want to write that good statement based on the SMART elements, and the goal, again, should be descriptive and concise. We're going to post that written goal where it's visible and discuss the current status, successes, and failures as they come up. Your written goal serves as a reference tool when you're getting together and discussing what is occurring in your facility. So how are we going to write our statement? Here are some sample statements that we've provided. The first, by December 2018, ABC Nursing Facility will reduce readmissions for all residents as measured by a decrease in the 30-day all-cause readmission rate by 15% from 27% to 23% or less. So you may actually use one of these statements as the statement that you are using your goal statements. We've provided those as examples for you. And again, post this goal so that your entire team is looking at the same information and working toward that same achievement. Next, we're going to select our population. We are going to base this on what we've learned in the 30-day all-cause readmission data. We may select 1 or 2 units that we're having high readmission levels. We may select a specific segment of the population. That's what we're going to do. We're going to start with a smaller segment of the population and then move to a facility-wide population if the measure is working. Okay. And now we're going to select the team who is going to be implementing the performance improvement. So our frontline improvement team can vary from organization to organization. A typical frontline improvement team includes an interdisciplinary membership. Ideally, you're going to involve individuals who will actively assess the residents, those who teach and facilitate resident education, and individuals who communicate essential information during handovers to and from other care settings. And, of course, members who are arranging the post-SNF care follow-up. Our frontline improvement team will initially test the key changes on the units. A typical frontline improvement team is interdisciplinary in membership. Once we have our goal, we're going to create a charter. What's a charter? The project charter clearly establishes goals, scope, timing, milestones, and team roles and responsibilities for a performance improvement project. That's the PIP that we talked about, or the PIP. The PIP is a concentrated effort on a particular problem in one area of the facility, or it could be facility-wide. It involves gathering information systematically to clarify issues or problems, then creating and implementing interventions for improvements. The facility conducts PIPs to examine improved care and services in the facility that have been identified as needing attention. Areas that need attention will vary depending on the type of facility and the unique scope of services they provide. The PIP charter is typically developed by the QA-PI team and then given to the team that will carry out the PIP. So the PIP team has a clear understanding of what they're being asked to do. The charter is a valuable document because it helps the team stay focused. However, the charter doesn't tell the team how to complete the work. Rather, it tells them what they're trying to accomplish. At the bottom of the slide is the link to the CMS QA-PI website, which houses the Element 4 PIP charter template. Whenever you're starting a PIP, it's important to get the right people together to plan and implement the project. Team members to consider for this project need to be using a multidisciplinary and interdisciplinary team approach to select the changes, strategies, and interventions to bring about that improvement. How do we know if our PIP is effective? To determine whether a change results in improvement, it's important to develop measures such as process measures and outcome measures. Process measures quantify and qualify what the organization does to make sure the system works. Outcome measures reflect the impact of the intervention. And how are we going to establish that measure? Again, that measure we are going to use various resources to provide us the numbers. We're looking at the CASPER report, MDS report, and you see here the tool that helps you to form how to establish a measure. So again, QA provides every document or tool for every step of the way through the QA-PI process. We're moving into the model for improvement, the PDSA cycle. The PDSA, or Plan, Do, Study, Act cycle drives your improvement. It's a pragmatic version of the scientific method used for action-oriented process improvement. A team conducts small-scale tests of change in the real-work setting by planning a test, trying it or doing it, observing the results because observation yields significant learning at this portion, and studying those results, and then implements changes or acts on that information. So for the planning, what change can you make that will result in an improvement? Start with planning your strategies. Define the processes currently in place, identify opportunities that exist, and decide what will change in the process. Determine your interventions based on your RCA analysis. Why are we testing our changes? The reason we're testing the changes is to ensure that there is going to be success once we have started. So the testing should include a variety of conditions, for example, when we have short staff and we have plenty of staff, when we have a variety of residents and family caregivers to participate. We should test our changes during the weekdays and on weekends and days where we have high admissions and fewer admissions, and to ensure that it isn't what's occurring in the facility that's going to affect the process, but that it's a sustaining process. Okay. So the next item we're going to do is by running a test on a small scale. Once the strategies are chosen and your planning is done, you can progress to the do stage of the PDSA cycle. And during this stage, you will test your strategies on a small scale, perhaps with 1 unit. Document your observations, including your successes, problems, and unexpected findings. And then collect the data you identified as pertinent when your team developed the goals and measures. We're going to draw the data from multiple sources, and we did talk about that. We talked about that in previous slides. What's our rate of rehospitalization? who is being affected, and how are we going to work with them to improve those rates. We are going to study our data. As you're testing the strategies, you're also going to be collecting data to determine if the strategies are working. You might be looking at outcome data or process data. Analyze it to determine if your strategy is working. And again, we're looking for those unintended consequences, successes, and failures. And then act. After you've analyzed the data, act on what you've learned. Adapt or modify the strategy and repeat the cycle if things aren't working out quite as you had hoped. You're on the right track, but you may need to adapt some things to ensure that that process is going to work for you. If it's working right out of the gate, it could happen, adopt that change and then test it on a larger scale. If you're finding that the results are not effective at all, abandon the strategy. And again, this may be one of those situations where you're getting information about a process that isn't working. It's not pertinent to your readmissions. Table it and come back to that. All data that we gather is valuable, so you may come back to that at another time. Continue to act and change your approach, identify a new strategy, and once we're taking that test to the larger population, we're going to begin a new PDSA cycle. This is where leaders are coming in to help with the process. Leaders should be planning for the spread of that improvement, which means we may need to include more of our staff in order to assist. We may need to work with a larger population. We have to have a spread plan in place in order to take that test out into the larger population. A successful spread of reliable processes requires leaders to commit the sufficient resources to support the spread. The QAPI PDSA template is a useful tool in helping your team control and direct the improvement cycle. The initial testing population is limited to determine if a population-wide standard of work should be adopted. Fewer resources are required to test the limited population, and results may be returned sooner as well. Once a process is deemed reliable and valuable, the process should be expanded into the larger population, and if this process continues to be successful, it becomes adopted as a standard or normalized work. Once you've identified and implemented strategies that have proven successful for reaching your specific goals, don't stop. Ensure you've developed a change that will prevent staff tendency to deviate from the standards and continue despite staff turnover. How do you do that? The Sustainability Decision Guide that will assist you with as a resource is located on the CMS QAPI website. Use this resource tool to evaluate the value of the changes you've made, the likelihood of sustainability, and confidence for the process adoption. These tips are included to help maintain an improved quality process. Okay. And we're providing, again, the resources for you. The QAPI information is quite comprehensive. It's available at your fingertips. And if you have any questions, the Lake Superior QIN is here, and we want to help you in your QAPI expansion. Okay. And we do have an event coming up on Thursday, August 30th, a continuation of our strategies to reduce readmissions. And you can download the change of condition process evaluation tool to take back to your facilities as post-work. And I think what you'll find exciting about the communication strategies event on Thursday, August 30th, is you're going to be hearing from your peers, those of you who are in the field and having successes. And we're really excited about presenting that information for you.